So the Digital Medicines Transformation Portfolio is a collection of programs and projects that individually are tackling parts of the system that gets medicines to patients in Wales. And individually, they're looking to make changes in different parts of the system, but together the portfolio, the collection of programs and projects, is looking to transform the whole situation, the whole way that medicines are prescribed, administered, dispensed, and indeed paid for within the NHS in Wales. And it's necessary because medicines are a really important part of healthcare. They represent a significant experience for patients who take medicines. There are 81 million prescribed items just by GPs alone every year in Wales. So it's a really important area of medicine. And at the moment, it's really inefficient. A lot of it is transacted on paper. You'll know that you have to get a prescription form signed by a doctor with a pen and taken to a pharmacist, for example. And that introduces inefficiency, but it also introduces some safety concerns as well. And so the portfolio is aiming to make the whole process safer, easier for patients, easier for clinicians, and more efficient all round. So now that we've established the portfolio, the very first thing we're doing is to make sure that each of the programs and projects, and there are 4 of them, each of those is set up on a sound footing and has the right processes and governance, which, although that's a bit dull, is really important to make sure that they deliver the benefits that we want to see. The other thing is that it's all quite complicated, and the portfolio's job, in part, is to help join up the 4 processes, the 4 projects and programs, because they all have connections to each other, to make sure that we end up with a really good joined up system, not 4 separate systems that aren't talking to each other. So our first priority is to make sure that we can understand what all those connections are and make sure that they're clear and that we have a plan to make sure they work well. Well, the whole programme of work is really big. And so what people will notice is changes in phases. There's not going to be a sudden big bang change. But one of the first things I think that people will find is instead of when they go to the doctor, the GP, to get a prescription, that they don't have to wait for a paper form to be printed out and signed. They'll be able to say either in person or in fact electronically, to be able to say to the GP where they would like their prescription to be dispensed, where they'd like to collect it from, and it will automatically be sent there electronically. The patient doesn't need to do anything electronic. It'll all happen for them. They just go to the local pharmacy, the one that's nearest or most convenient for them, that they've chosen to collect their prescription. If they go to hospital, to an outpatient appointment, they'll find the same thing. Instead of having to be given a paper prescription and take that to a pharmacist, again, it will be possible for that to be sent automatically to the pharmacist that they would prefer to collect it from. If they're unfortunate enough to be admitted to hospital, they'll find that the days of the paper medicines chart that used to be clipped to the end of the bed and that doctors had to write out by hand, that will be a thing of the past. Nurses will be administering the medicines from a digital drug chart, and that drug chart will have been pre-populated with medicines that the patient was already taking when they came to hospital, and the doctors will check those to see if they want to carry them on or make any changes to them. But they won't have to keep asking patients, what medicines were you taking when you were at home? That'll all be visible to them already. And when the patient leaves hospital, again, the information about the medicines they had in hospital will automatically be transferred to their GP. So no risk of any mistakes in copying down medicines from one system to another. And then over time, when the NHS Wales app is available, patients will find that they're able to see the medicines that they've been prescribed, and we're going to build a record that gives a whole picture, or a much more complete picture, of the medicines that people are taking, whether they get them from their GP, maybe a prescription of a painkiller or an antibiotic from the dentist, perhaps a specialist treatment from a cancer centre or from a hospital, bringing it all together so that everybody can see all the medicines that people are taking. And we'd like, indeed, to include in that the medicines people buy over the counter that aren't prescribed, so that their clinical teams and the clinicians they encounter and themselves have a full picture of all the medicines they're taking. And that's really important because there are quite often interactions between those medicines, and it's really good to know what people are taking before you add to their medicines list. I was really delighted when I was asked if I would play my part in this portfolio. It's clearly a big job, and I'm doing it alongside my work in the university, but I've always cared hugely about improving the safety and quality of care in the NHS, and medicines is a big part of that. And I genuinely believe that if we can, when we complete the work of the portfolio, that we will be leaving things in a much better and safer place. I also am very passionate about empowering patients, sharing knowledge about people's care with them. These are their medicines, it's their illnesses, and it's right that they should have a better understanding of the medicines they take, why they take them. They can see them, they can share them with carers or family members if they wish to. And so this is a great opportunity to really change the way we engage between clinical teams and patients over this really important aspect of healthcare, which is medicines.